Welcome back to East Texas Live. Dr. O'Kelly's here. He's with Christus Trinity Mother Francis, and he's going to talk to us all about something that maybe we don't even have that much experience with, or maybe you do, but the measles.
Right.
So tell us a little bit. It seems like it's on the rise right now. Why is that?
Yeah, so we have had more cases of measles in the past several years, mainly because we've had an increase in people that aren't vaccinating their children. You know, if you think about back in the 50s and 60s, we were having, before the vaccine was created, we had 5,000 deaths every year on average from the measles, and now we're seeing an uptick of 200 to 300 cases a year, and we're realizing that we're back on an uptick, and it is kind of concerning for us in the healthcare field about seeing this happen today.
And you're mentioning vaccinations. Who should get vaccinated, and how can they do that?
Right, so the vaccination schedule for the MMR vaccine starts at age 12 months, and they get one vaccination when they reach that 1-year birthday, and then we give them another vaccination before they start school, so about age 4 or 5. And if they get 2 vaccinations, then their ability to fight off the measles is at 98%.
Oh, wow. Very impressive.
Right.
Okay, so I know there are people out there who maybe aren't vaccinating their children. Maybe they have hesitations about that.
Right.
What's kind of your response to that?
Right. Well, my conversation with people who are afraid of vaccinations or anti-vaxxers, I have friends that are, it's just educating them, you know, not ostracizing them. We know that ultimately they want what's best for their children, and we in the healthcare field want what's best for their children too. And so I always tell people, you know, if you have concerns, if you have questions, if you want to talk to us, then certainly make an appointment. Come by and visit with us, and we can talk to you about what are the side effects, what are the side effects of the vaccination, what are the side effects of getting measles, because it's amazing how quickly we forget history that measles can cause encephalitis, it can cause pneumonia, that measles causes death, and so it's a very dangerous disease to not be taken lightly.
So if someone was to have the measles, what would you be seeing? Like, what would be the warning signs?
Well, you know, I've only read about it.
Really?
It's because we've gotten rid of it. I've never seen a case of measles. You know, we only have 200 to 300 a year reported now, but what it is you see high fever, typical upper respiratory infection symptoms along with a rash. And that's what's honestly concerning for a lot of us as physicians is, are we going to misdiagnose it because most of us have never actually seen it.
Right. Well, are there any, since it is so rare, are there any myths surrounding it or things that people should know for sure about it? Anything you want to make sure that people definitely know coming out of this? I
think the big thing to know is that measles can be dangerous. I think a lot of people think that if I don't vaccinate my kid and they get the measles, then they'll just get immune to it that way. And there is some truth in that, but you're running the risk of your child getting encephalitis, getting pneumonia, getting put in the hospital and possibly dying. We're not talking about a simple cold here. We're talking about a deadly disease that used to kill 5,000 people a year.
If you didn't get vaccinated as a child, what are kind of your options later on? Will it affect you if you were to get the measles later in life?
Yes. In fact, many of our cases that we're seeing now are adult cases of measles. So it can affect you if you've never gotten the vaccination before.
Very interesting. All right. Well, I'm sure it if people wanted to know more about the measles or anything else, do you have any place that they can look that up?
Right. Well, they can make an appointment with me with Christus Trinity Clinic. I will be glad to sit down and talk with them, talk with them about their concerns, answer any questions they have about the vaccination and how it is so much safer than the information that we're getting out there, and ultimately is the best thing for our children and our population as a whole.
Perfect. Well, thank you, Dr. O'Kelly. Thanks for joining us today and for all of that wonderful information.